What is spinal stenosis? Spinal stenosis is a choking of the nerve that occurs when a disc loses its height, okay? And when your disc loses height due to disc protrusion or disc herniation, what that does is that it literally, as you can see here in my model here, if you look at the gray material here, which is your disc, and this here is your IVF, which is the holes where the nerve exits from your spinal cord, okay? If you can visualize that when your disc here gets narrow and it literally closes down the hole where the nerve exits. So here you can see when it closes down, it pinches the nerve, okay? The word stenosis itself literally means a choking of the nerve, okay? That's why people often have pain that goes down the legs. They oftentimes have issues with walking. They might even have numbness to tingling when it goes on for a prolonged period, such as months and months and months and years. It is a very debilitating disease, believe it or not. It is actually a culmination of your arthritis or degeneration of your spine. Now, what does that mean? Well, it doesn't mean that everybody that has spinal stenosis has to be older. Some people do have spinal stenosis and that we see that are in their 20s. And typically that occurs from very severe trauma such as car accidents or slipping falls, where it causes early process of disc degeneration, again, where the disc loses its height and that forces the spine to literally shrink and comes together more, and that pinches that nerve. Now you can also have spinal stenosis where the disc material is sitting in the canal that also causes another choking of that nerve, which in this case here is the same thing as the nerve compression, but it does limit the hole where the nerves actually exit. So anything that limits or narrows the holes where the nerves are exiting from your spinal cord can cause what we call spinal stenosis of your spine, okay? So, but most of the people, as we get older, if you don't have good access to health to help to prevent your discs from degenerating, okay, then it's going to lead to arthritis. And when you have your spine that leads from disc injuries to arthritis, it's going to typically culminate into spinal stenosis. So how do you prevent spinal stenosis? Well, the word in itself, prevention, is the key, okay? You don't just get spinal stenosis as you age. It's because, again, it's due to wear and tear, falls from past injuries, that slowly gets worse with age. It's not due to aging, because a lot of people have that age and they're in the 80s and 90s that do not have spinal stenosis. Okay, now they might have narrowing of the spine, but it's not literally choking the nerve itself, causing leg pain or numbness or tingling in the feet or down the legs. Okay, so it typically is caused from mismanagement of your spine. Okay, in this case here, you're not exercising, you're overweight. Okay, you're not getting proper treatment with chiropractic care, PT, whatever it is. You're not doing strengthening exercise to help to stabilize your low back. You're just not doing enough things for your spine, for your spinal health, to prevent your spine from degenerating. Because we know for a fact that when your spine degenerates and your disc degenerates, you're gonna get spinal stenosis as you get older if you don't do any preventive treatments or preventive exercise to help to keep your spinal in good shape. All right, so thanks for joining us. If you have any questions about your spine or any other conditions with regard to extremities and joints, please let us know, and thanks for liking our channel.